Hi, everyone. Welcome to our first afternoon session. My name is Tina Costa, and I'm a director with the Office of Virtual Health. I will be your host for this virtual session yet again, and it's my pleasure to welcome or re-welcome you to day 2 of the 2023 BC Digital Health Forum, inspired by Canada Health InfoWay's Digital Health Week. For those joining our virtual circle this afternoon, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations as we continue to engage, learn, and collaborate in the realm of digital health. Let us give thanks for the privilege to do so on these beautiful sacred lands, and may our discussions contribute to a future where Indigenous voices are uplifted and the principles of reconciliation guide our path. It is with great pleasure that I get to introduce our next presenter, Dr. Shazhan Amed. Dr. Amed is a pediatric endocrinologist and head of the Division of Endocrinology at BC Children's Hospital. She is a clinical professor at UBC and a clinical scientist at the BC Children's Hospital Research Institute. Dr. Amed's vision is that all children and their caregivers living with diabetes in BC have access to equitable, compassionate, and state-of-the-art care where they are empowered as patients, partners, to optimize their health and well-being so that kids can flourish and diabetes doesn't get in the way. Thank you so much, and over to you, Dr. Amed.
Hi, everyone. Thank you for the opportunity to speak today. I will be talking about transforming pediatric diabetes care through digital and data-driven innovation. And I'm feel so privileged to be part of this amazing project called Trustsphere, a collaborative and personalized digital care experience. These are my disclosures. And in terms of learning objectives for today, by the end of this session, I hope that all of you will be able to outline an approach to co-creating a digital solution, understand how Trustsphere supports clinical care and research participation, and describe and apply strategies for real-world implementation and evaluation of digital clinical care solutions. So pediatric diabetes is Trustsphere's first test use case. Let me tell you about Ethan, an 8-year-old boy diagnosed with type 1 diabetes. At the time of his diagnosis, his parents were wrought with worry and devastated by this lifelong, life-changing diagnosis. At the time of his diagnosis, him and his parents were given this paper binder and participated in 3 full days of diabetes education, where they learned how to manage Ethan's diabetes at home, at school, when he was at hockey practice, and even at fun events like birthday parties. Over the years, Ethan has lived with diabetes. This paper binder has expanded with information such as glucose logs, written paper notes from Ethan's doctor outlining his new insulin doses, paper handouts on the greatest and latest diabetes technology like glucose sensors and insulin pumps. Ethan and his family carry this binder to all of his appointments. But what if this binder was replaced by a single trusted digital solution, where all of this information was digitally accessible to the patient, their family, their healthcare team, and even others within their circle of care, like their family doctor or the person who supports Ethan with his diabetes at school? I'm going to walk you through the journey of the development of Trustsphere. And what I want to start with is stakeholder engagement underpins our work. We went through 4 stages over the course of this project: a needs assessment, usability and co-creation, a pilot study, and what the future holds for us is a real-world quasi-experimental study. In terms of our needs assessment, we really spent a lot of time doing this formative evaluation to understand both the perspectives of subject matter experts, including healthcare providers, patients, researchers, members of our consortium, and provincial partners. We did this through qualitative interviews and focus groups to understand their pain points in the patient journey, a desired future state, key features and technical considerations of and the broader environment and ecosystem of digital health. We also conducted a North American-wide survey of parents and youth to gather their perspectives on what would optimize digital trust and the likelihood of using a digital platform like Trustsphere, which I'll show you soon. And we also engaged diabetes healthcare providers and people with lived experience to understand the barriers that they faced in caring for type 1 diabetes. We then went through usability and co-creation phase, where we went from concept to prototype to minimal viable product. And then we conducted a small pilot study. And what we hope in the future is to conduct a quasi-experimental study where we can understand the impact of Trustsphere on health outcomes in children living with type 1 diabetes, and the impact of Trustsphere's implementation strategy on the uptake, usage, and adoption to eventually develop an operational product. So let me walk you through what we learned through all of these phases of work. The first was understanding digital trust and willingness to share personal data. In this North American-wide survey of over 1,000 parents and almost 200 youth, we learned that more than 90% of parents and youth were very or somewhat concerned regarding online data privacy and security, emphasizing what we learned from the literature, that digital trust is one of the key barriers to people adopting digital health solutions. But we also learned that more than 70% of parents and youth are willing to share their or their child's personal health information if it creates progress in not-for-profit health research. When we specifically surveyed caregivers of children with type 1 diabetes and asked them, what is your biggest challenge that you face related to caring for your child? Many things bubbled to the top that could potentially be addressed by digital health. For example, access to diabetes management technologies, support for care in school, access to mental health support, accessing medical information like the data that they produce through their sensors and pumps and lab test results, and connecting with their diabetes team between visits. When we asked a similar question to healthcare providers, when providing care to children with type 1 diabetes in your clinic, to what degree do you find these following things a challenge? Similarly, accessing mental health support bubbled to the top. The more red you see, the higher likelihood it was a challenge. Having sufficient human resources in clinic, helping patients navigate technology, accessing data from insulin pumps, and sharing care plans with others on the healthcare team or in their circle of care. In our qualitative interviews and focus groups with our subject matter experts and people with lived experience, we learned what the challenges were faced by clinicians and patients. Some of them are depicted here. Clinicians don't have time to meet patients' requests or see them regularly. They have trouble ensuring patients are following their care plans or find it difficult to provide consolidated resources. Patients and families feel that their care is fragmented and access to data is on different softwares, making it very difficult. They feel friction in accessing clinical care. There's no pathway to get quick answers or link to other services, and they have difficulty navigating to the right resource at the right time. And they offered us some ideas around priorities. Clinicians wanted to better support patients to self-manage. They want data, blood sugars, A1Cs, insulin doses, pump data, sensor data. They want care to offer better value and be less administrative cumbersome. And they want to be able to easily monitor their patients' adherence between visits rather than every 6 months at visits. Patients and families wanted frictionless access to care, easier access to tools, streamlined access to clinicians, access to data in one place, information that's digestible, and personalization of care. Through all of this formative research, we developed some key insights that then informed the development of our product. The first insight was that we needed a trusted doorway and consenting process for use of digital health apps for clinical care delivery and research. Optimizing digital trust was important. To do this, partnered with our industry partners, Identos, Smile Digital Health, Care Team, and Interact, we were able to develop a trusted doorway that integrated identity authentication, authorization, consent and governance, and data translation. Through this digital trusted doorway, patients are able to access digital apps that are patient-centered and personalized care. We also learned that patients want a personalized collaborative care experience and a single point of access platform and dashboard so that they can access the data they need when they need it, both clinicians and patients looking at the same dashboard together for a collaborative care experience. To do this, we needed to establish continuous data synchronization into a patient dashboard that's viewable by both the patient and the healthcare team. We developed our minimal viable product in partnership with companies depicted here who offer diabetes devices, such as continuous glucose monitors, insulin pumps, and glucometers. Currently, we're exploring the possibility of integrating with CST to get next appointment or point of care labs, as well as using the digital tool to collect patient-reported outcome measures and experience measures. After generating these insights, we went from concept to prototype to MVP through 3 rounds of usability testing that included parents and youth, as well as pediatric diabetes clinicians. Each round was followed by rapid data analysis and iteration of the product and the prototype, and MVP was released in 2022. Let me show you what that looks like. It's called the BC Children's Hospital Care Hub. I will be referring to it as Trustsphere, but what patients see is the BC Children's Hospital logo and the My Care Hub account. Within this digital wallet includes digital applications. Care Team is the clinical part. My Data for Research is the research part. We also included applications like Breather, developed by BC Children's Center for Mindfulness, in order to support the mental health needs of our patients, as well as Learn Diabetes, a brand new virtual education platform that allows them to access information they need when they need it. As a first step, the trusted doorway and connecting devices is important. We were able to integrate with the BC Services Card for identity verification that happens at the creation of the Care Hub account. After the Care Hub account is created, patients can then link their devices. In this case, the wearables include diabetes devices. Once the device is added by the patient through the appropriate consent and assent mechanisms, the data that those devices produce are automatically pulled from the vendor's cloud into the Care Hub using APIs. Clinicians also have a clinician-facing portal that's accessed through the web, and they sign in using their PHSA credentials, which is the way that they authenticate their identity. Care Team is the clinical care part. When patients enter into the Care Team application that we have customized in partnership with Care Team for type 1 diabetes, they can immediately see their data. This is glucose data coming from a glucose sensor, shown in a way that allows them to use the data to adjust their insulin and engage in diabetes self-management. They are also able to see their insulin doses, editable by them as people who manage diabetes at home, but also editable by their clinician, who can provide advice between visits or at their visit. They can also see recommendations from their clinical appointment, all of them available for them to look at in one single place. They can access important educational documents or resources that support them in times of illness or hypoglycemia. The app allows us to assign tasks as well that have been very helpful through the pilot. One of the most popular tasks was the clinic visit preparation form that was completed by the family prior to their visit. By answering these questions right inside the app that were then immediately visible by the diabetes team, we could actually personalize their visit and ensure the appropriate clinicians were there to give them the care they needed and meet them where they were at in terms of their clinical needs. My Data for Research is the research part of the application. The research part allows families to engage in a digitized patient-centered research and consent and assent process that allows them to donate their de-identified data to a research registry. What we have here are screenshots of the app that allows families to understand what research means. Who are we? What does consent mean? And once they have familiarized themselves with the process of research using very simple and patient-friendly terminology, the children can engage in an assent that's digitized, and the parents in a consent that is digitized, and that explains what we're doing and how we're using their data. Once they consent on the app, data is then shared with scientists through an API where it is automatically transferred to a registry at the BC Children's Hospital Research Institute. They are also given the option of providing their PHN so that we can link their data with other data sets, including the BC Pediatric Diabetes Registry. They receive access to their dashboard that shows when they've consented and for whom. They can always see why we're collecting data if they've forgotten or want more information. And at any time, they can stop participating by pushing on this button. The data for all consented patients is periodically transferred after being de-identified into a Trustsphere registry that sits at the BC Children's Hospital Research Institute that can then be used by researchers and quality improvement researchers to improve care. Now, let me tell you about the pilot study that we conducted for 6 months once we had our MVP. In this pilot study, we onboarded a first group of patients onto the Trustsphere application, and we collected data, rapidly analyzed that data, iterated the product in a release 2, onboarded another additional 12 people, and then collected more data, analyzed it, and iterated the product in a release 3. We collected data on satisfaction with care, diabetes management behaviors, and quality of life at baseline, as well as at the end of the pilot. And during the pilot, importantly, we collected data on usability and user experience, which I'm going to show you now. In our initial data of our pilot, we were able to collect surveys from the parent users of Trustsphere. What we learned was 88% of parents used CareHub to prepare for their clinic visit, and 59% of parents felt CareHub was helpful or very helpful during their clinic visit. 76% of parents felt their clinic visit was slightly, somewhat, or much or very much more personalized, and 94% of parents will possibly, probably, or definitely use CareHub at home. We also conducted surveys with clinicians who engaged with Trustsphere during the clinical appointment and used the clinician-facing web-based application. Of 41 surveys that were completed, 90% of HCP were satisfied with using Trustsphere in clinic, 90% felt more prepared for their clinic visits, and 88% felt their patient interaction was improved. In looking at digital trust and data security, we learned from parents that 71% agreed or strongly agreed that they felt their child's data was safe and secure in the CareHub app. 72% of parents and children consented and assented to share their data to the research registry. And of those, 77% also agreed to data linkage using their PHN to other registries. We also conducted post-pilot qualitative interviews with caregivers, and in our initial analysis of the qualitative data, we've generated 4 key themes. The first is that Trustsphere has the potential to support personalized patient care experience through enhanced connection and communication with the healthcare team. One patient said, well, it's nice to have one place where you can look at your sensor and pump data together. And the best part about it was that I'm able to enter information. And also the doctor can send notes or information in the app as well. So after our appointment, the doctor entered the recommendations in the app, and it was easy for me to access them. That was excellent. Our second theme was that it's important to consider the ways new platforms may complement or duplicate caregivers' existing systems, routines, and habits. We know that many caregivers and patients have lived with chronic disease for a number of years and have already built their systems. How do we build something that is complementary and not duplicative? The third theme was the need for more platform features that encourage or nudge ongoing healthcare provider and caregiver or patient engagement to support diabetes self-management. One patient said, I would love to see more correspondence through the app to be able to access information and ask questions. Theme 4 was that caregivers expressed the importance of ease of use of a platform with independent onboarding and navigation. In our pilot, our research team actually walked each participant through the onboarding onto the platform. As we scale, it's really important that we understand what measures we need to take and what additional development we need to do for independent onboarding onto the platform. But I would be remiss if I only showed you the data of usability and usefulness and not all of the hard work that went into the change management in order to get our clinicians and our patients to use this platform in the pilot. It's important to remember that digital transformation is a process, not an event. So to start, we really engaged our subject matter experts in co-creating a change vision. Now, often in change management, the literature will say create a sense of urgency. And Trustsphere actually got off the ground at the time of the pandemic. And so already this sense of urgency was in the air. And with CST becoming part of our organization or just a year later, that sense of urgency was just growing. We engaged end users really early in the project in order to create a sense of ownership among patients and caregivers and healthcare providers. The second important part of our process was empowering change agents, identifying early adopters and champions who really wanted to be involved in that usability testing, in providing us with their feedback on what would work and what wouldn't. Shifting the mindset of our diabetes team as we talked about this digital project from what is to what if, which is a change mindset. Something we didn't do formally, but I see as being really important in our future work is scenario mapping. Rather than envisioning one version of the future, imagining different versions of the future. Scenario mapping is something I learned in this article that I've referenced here, but because we started a little bit late, I'm not going to get into the details, but something that I feel could be really useful as we want to get more buy-in into the product. The other things we did was communicate early and often. We held multiple rounds of usability testing. We had regular updates with our diabetes team meeting. Our healthcare providers were prepped before clinic and debriefed after clinic with our research staff during the pilot. Our research staff continuously engaged with our pilot participants. We had a test and learn mentality and were flexible. We had ongoing listening mechanisms to allow for us to understand what was working and what wasn't working. And we used that information to iterate the product to ensure that there was value for the end user and relevance to the context, which was actually rapidly changing as we started to emerge out of the pandemic. Asking the questions, what is needed and what isn't delivering value, was really important. As we move forward, I really like this quote from this article by Jeff Kavanaugh and Rafi Tarafdar. The sum of many micro changes brings about the larger change, creating a cumulative effect that delivers nonlinear improvements with greater likelihood of overall success. We have taken a micro change in our clinic in terms of conducting this pilot, putting Trustsphere in the hands of 19 of our patients and at least half of our clinicians. This article talks about measuring change at scale, where we have to really look at adoption as micro changes and slowly building up to that point of assimilation. At a prototype level, the expectation is about 2.5% of the entire user population is adopting and using the technology. Our next step is to move into significant adoption, which would be 20 to 40%, and eventually to have the Trustsphere platform assimilated into our clinic at around 80% adoption. Interestingly, in our pilot study, we had 19 of our 750 patients that we follow at the diabetes clinic at Children's, which is about 2.5%. So we've hit the prototype target and look forward to getting up to increasing adoption to being significant as we continue to develop the product and engage our patients. So the future of Trustsphere and digital health, we hope to have wider implementation in pediatric diabetes across BC and Canada, adapt and scale for use in other pediatric chronic disease conditions, enhance access to a broad range of near real-time data through that care hub and those data integrations to support personalized care in our learning health system. We want to continue to deepen patient engagement and research across BC and Canada, because I do feel that our engagement with patients and clinicians during this work is really what sets us apart. And we want to continue to advance our progress in achieving the goals of the quintuple aim for healthcare improvement. I'm excited to share that we have received funding from the JDRF and the CIHR for a project for 5 years called Precise Treatment for Pediatric Diabetes, providing the right care for the right patient at the right time over time, which will provide us with the support we need to continue to develop the product, get it into the hands of more patients at our clinic and across the province, and use the data for more sophisticated uses using machine learning and artificial intelligence. Now, none of this work could be done without this amazing team depicted here. People who represent and bring expertise in all sorts of disciplines have contributed to this work, in addition to our industry partners, Idento, Smile Digital Health, Care Team, and Secure Key, who is now Interact. Thank you so much for listening. I hope I've left some time for questions, although I know we started late, but I will end there.
Thank you, Dr. Amed. What a great and powerful presentation. I really appreciated that emphasis at the beginning, particularly around digital trust and how, particularly in a space where all of us are bombarded with digital tools in every aspect of our life, to support patients and families to know and be able to discern what's safe and what isn't, and in particular for their healthcare. So thank you for that. We are short on time, but we'll maybe do one quick question if we can, and then again, encourage people to reach out. So the question I'm going to ask, first of all, comment remarkable results from patient and staff. Thank you very much. Question is around patient demographics. And so were patient demographics such as race, gender, Indigenous identification captured? If so, were differences observed?
Yeah, it's a great question. As you can imagine, in such a small pilot, we had a very biased sample. So these were highly digitally literate families who sort of put their hand up and said, we want to be part of this. So it definitely doesn't represent a broader, diverse demographic. And that's something that we are really, in the next phase of this work, focused on. We've engaged individuals on our team who have expertise in equity, diversity, and inclusion, and really thinking about how do we make something like this accessible to a broader population, to different demographic contexts, to different races, ethnicities, and in particular to those who are marginalized or those who live in areas of the province that actually don't have easy access to digital solutions. So these are all things we're thinking about. We did collect demographics, but I can tell you that the majority came from a very similar high sort of SES demographic.
Wonderful. Well, thank you so much. Apologies, we don't have time for any more questions. We will close out this session, and thank you once again for joining. You'll see the poll come up to get a bit of feedback on this particular session, and we will invite you to join our next afternoon session, which is entitled Structured Data Collection Through Virtual Health in Sleep Assessments and This Hi-Fi Study. So thank you to all. You can navigate to that using and clicking on the session title on your left-hand screen of your left-hand side of your screen. Again, thank you, Dr. Amed.
Feel free to email me if you have questions.
Great.